Hello everyone, welcome back to another recall session. So today we're going to discuss with you about the recall questions of physiology subject of INI-CET 2022. So let us start discussion of the questions. So the first question is, which physiological adaptation does not happen at high altitudes? So let us look at the options. Pulmonary vasoconstriction. Yes, it happens at high altitude because of alkalosis and low oxygen level at high altitude. Polycythemia, yes, it also happens at high altitude. Respiratory acidosis, no. Respiratory alkalosis happens at high altitude, not respiratory acidosis. And hypoxia, yes, it happens at high altitude. So the physiological adaptation that does not happen at high altitude is respiratory acidosis. Actually, respiratory alkalosis happens. The next question is, countercurrent mechanism is present in which of the following parts of the body? So let us look at the parts given here. Eye, no, there is no countercurrent mechanism present in the eye. Testis, yes, the counter-current mechanism present in the testis. Kidney, yes, it is also present in the kidney. Gut, yes. Lungs, yes. So counter-current mechanism is actually present in testis, kidney, gut, and lungs. So the answer here is 2, 3, 4, and 5 are correct. Okay, so the D is the answer. The next question is, match the following molecules with their carriers in plasma. So thyroxine, the organic substance that is prealbumin is there. Fatty acid, it is associated with organic substance of albumin. Hemoglobin is associated with haptoglobin and heme is associated with hemopexin. So 1B, 2C, 3D, 4A is the answer. So the answer here is A. The next question is, myosin ceases to be in contact with actin filaments as a result of. They are asking that myosin detach from actin. This happens because of, let us look at the options. Dissociation of ADP and inorganic phosphate. No, that not lead to detachment of myosin from actin. Cessation of calcium release from sarcoplasm? No, that is not the answer. Conformational change in troponin T? No, that also not lead to myosin contact seize with actin. The last option is attachment of ATP to myosin head. Yes, when myosin head attaches with ATP, that lead to cessation of attachment of myosin to actin. Okay, so the answer here is D, attachment of ATP to myosin head. Transport of iron into enterocyte is done by which of the following proteins? Simple, straightforward as well as factual question. Answer is divalent metal transporter 1. The next question is vessel A has a length of L and diameter of D, and vessel B has 2L length and 2D is the diameter. Considering the flow is laminar through both the cylinders, the flow through B is how many times as much the flow through A. Okay, so this acts according to the formula of Poiseuille-Hagen formula, which states that the flow is radius of 4 quarter upon L proportional. Okay, so flow is directly proportional to the radius fourth quarter and inversely proportional to the length. So radius become 2 times, so that becomes 16, and length becomes also 2 times, so it is 2, so it will become 8 times. The answer is B. The next question is if the pH is reduced from 7.4 to 7.3, with the pressure of oxygen being constant at 100 millimeter of mercury, which line would pressure of carbon dioxide follow? So pH is decreasing, pressure of oxygen constant at 100 millimeter of mercury. Okay, they are asking the line at which would pressure of carbon dioxide would follow. So they are telling in this question that pH is decreasing and pressure of oxygen is constant. Okay, so when pressure of oxygen remains constant, slope remains constant and pH decreases, so that the graph's intersection on x-axis shifts to left without change in the slope. Okay, so intersection shift to left. So the answer here is A, number 1 graph. Okay, so that graph intersection changed to the left side without changing in the slope of the graph. Okay, the next question is substances and the type of transport across a membrane are given below. Choose the correct combination. So let us see the substances and the type of transport shown in the statements. Oxygen by simple diffusion. Yes, it is correct. Glucose by facilitated diffusion. Yes, it is also correct. Sodium through voltage gated channels. Yes, it is also correct. Sodium secondary active transport. Yes, that is also correct. Calcium through active transport. Yes, it is also correct. So the answer here is C, 1, 2, 3, 4 and 5 are correct. The next question is A and B in the graph below represent which of the following ions in terms of permeability for action potential generation. So here A is given and B is given. You have to find what is A and what is the B representation in this graph. Okay. So A represents action potential of a fast conducting channel as well as more ion permeability. B representing slow conducting channel as well as low ion permeability. Okay. So A is representation of sodium and B is representation of potassium. So the answer here is A. A is sodium and B is potassium. What is this yellow graph representation? This yellow graph representation is the graph of action potential. The next question is transcutaneous electric nerve stimulation is used to relieve pain. What is the mechanism behind it? So the mechanism by TENS to relieve pain is actually gate control theory. The answer is A. Gate control theory. The next question is the parents notice that their child is tired and that he has shortness of breath on climbing stairs and while lying down. What is the first investigation that you would do? So this scenario is suggesting of shortness of breath on climbing stairs and while lying down. This is a childhood asthma case. Okay. So the first thing that you have to do is to do chest X-ray to rule out asthma. So the answer here is B, chest X-ray. Match the following molecules with their carriers in plasma. Thyroxine as an organic substance as a carrier is prealbumin. Vitamin B12 organic substance as a carrier is transcobalamin. Hemoglobin, the carrier is heptoglobin, and the heme carrier is hemopexin. So the answer here is 1B, 2C, 3D, 4A. So the answer here is A. The next question is arrange the following steps of ventricular action potential in their correct order. So in steps of ventricular action potential, the first thing happens is opening of voltage gated sodium channels. Then second thing happens is transient outward flow of potassium. Then third thing is opening of voltage gated calcium channels. And the last thing happens is repolarizing potassium currents. Okay, so C, D, A and B is the correct sequence. So the answer here is option number C. The next question is what does the zero pressure indicate in the pressure volume curve? So in pressure volume curve, zero pressure literally means functional residual capacity. Functional residual capacity is the volume of lungs that remains after normal expiration and that will be 2.5 liter. So normal value of functional residual capacity is 2.5 liters. So the answer here is B, functional residual capacity. How is cerebral perfusion pressure is calculated? Cerebral perfusion pressure is equal to Straightforward formula, mean arterial pressure minus intracranial pressure. Okay. So the answer here is D, mean arterial pressure minus intracranial pressure. The next question is fluid leaving the proximal convoluted tubule in the absence of antidiuretic hormone is. So they are asking about fluid reabsorption that actually happening in the proximal convoluted tubule, but there is no ADH. Okay. So in proximal convoluted tubule, sodium chloride is reabsorbed 60 percentage and water is reabsorbed through aquaporin channels. These both actions are independent of ADH. Okay. So despite of absence of ADH, the fluid leaving the proximal convoluted tubule is actually isotonic. Answer is A. The next question is 2,3-bisphosphoglycerate causes the unloading of oxygen to tissues by 2,3-bisphosphoglycerate actually binds beta subunit of hemoglobin and that will lead to unloading of oxygen. So the answer here is binding of beta subunit of hemoglobin because binding to that unit will lead to unloading of oxygen. The next question is the graph below shows oxygen dissociation curves. What does the curve marked as A indicate? So let us look at the options. First of all, A curve is actually hyperbolic curve. So this curve showing that molecule is tightly bound with hemoglobin. Okay. So let us look at the options. Myoglobin. Yes, myoglobin binds tightly with oxygen and that will lead to more percentage of oxygen saturation than a heme molecule or hemoglobin. So the curve marked as A indicate a myoglobin molecule because myoglobin actually leads to more firm association with oxygen than normal hemoglobin molecule. The next option is carboxyhemoglobinemia. No, that will lead to low saturation of molecule with oxygen than myoglobin. The next two options are meth hemoglobin. No, that is also not the answer. And fetal hemoglobin. No, that is also not the answer. Because oxygen percentage or oxygen saturation is more with myoglobin than any other molecule. Meth hemoglobin, fetal hemoglobin, as well as the carboxyhemoglobinemia are not lead to that level of oxygen saturation and hyperbolic curve in the oxygen hemoglobin dissociation curves. Okay. The next question is which among the following organs has the least arteriovenous oxygen difference? So let us look at the arteriovenous oxygen difference of different organs. First one is brain, 62 milliliter per liter. Kidney, 14 milliliter per liter. Skin, 25 milliliter per liter. Liver, 34 milliliter per liter. Heart muscles, 114 milliliter per liter. So the answer here is kidney, because among all, brain, skin, and liver has more arteriovenous oxygen difference than any other. So the kidney is the answer because kidney has the arteriovenous oxygen difference is 14 milliliter per liter. The next question is, the image shows changes in the membrane potential during an action potential. The region marked between 4 and 5 is due to. This region is actually due to efflux of potassium because this is repolarization. Okay, so the answer here is D, efflux of potassium. The next question is, what is the value of normal tissue oncotic pressure? Simple, straightforward, factual question. 12 millimeter of mercury is the normal tissue oncotic pressure. The answer is A. The next question is, where is the signaling sequence in type 2 membrane protein located? So this one is straightforward as well as factual question. It is located inside the membrane and it is located at the N terminal end. Okay. So the answer here is inside the membrane at the N terminal end. The next question is, which of the following primary second messengers is involved in the contraction of ciliary muscles while focusing on near sub objects? So they are asking about accommodation reflex, primary second messengers. So it is actually phosphatidyl inositol triphosphate. Okay. So while focusing on near subject, contraction of ciliary muscle happens due to the primary second messengers, inositol triphosphate. The answer is D. The next question is, which of the following tissues are dependent on insulin for glucose uptake? So they are asking about the tissue which is dependent on insulin for glucose uptake is adipose tissue. Adipose tissue dependent on insulin for glucose uptake. So the answer here is B, adipose tissue. The next question is, the second phase of saliva secretion involves. They are asking about second phase of saliva secretion. So that involves first is active sodium reabsorption, then passive chloride reabsorption, active potassium secretion, passive bicarbonate secretion. So second phase of saliva secretion involves active sodium reabsorption, passive chloride reabsorption, active potassium secretion and passive bicarbonate secretion. You can remember this by one mnemonic: sodium chloride potassium bicarbonate, sodium chloride potassium bicarbonate, active passive, active passive, active passive, active passive, reabsorption, reabsorption, secretion, secretion, reabsorption, reabsorption, secretion, secretion. So sodium chloride potassium bicarbonate, active passive, reabsorption, reabsorption, secretion, secretion. This is the second phase of saliva secretion. The answer here is D. Okay. The next question is macula densa is made of specialized cells located at. So macula densa is located at the junction of thick ascending limb and distal convoluted tubule. So the answer here is C. Thick ascending limb and distal convoluted tubule junction. The next question is which of the following can be used to calculate the cardiac output? So let us look at the options that are given one by one. Echo. Yes, it can be used to calculate the cardiac output. Ventilation perfusion scan. No, it cannot calculate cardiac output. Thermodilution, yes. Fixed principle, yes. So A, C and D, the option number D is the answer. So A, C and D can be used to calculate the cardiac output. Next question is match the given cellular components with their respective marker enzymes. So let us look at the cellular components and marker enzymes. Mitochondria, the answer is D, ATP synthase, peroxisomes, catalase, Golgi complex, galactosyl transferase, and endoplasmic reticulum is glucose 6 phosphatase. So 1 is D, 2 is A, 3 is B, and 4 is C. So the answer here is B. The next question is consider the following statements about sympathetic, parasympathetic, and motor nerves, and which of the following statements are true? The first statement is sympathetic efferents are distributed all over the body or extensively, whereas parasympathetic distribution is limited. So this statement is actually true because sympathetic efferents are the fibers which are distributed all over the body or extensive distribution is there. But parasympathetic distribution is actually limited, which are located to the organs which are not in our control of action. The next statement is sympathetic fibers travel long distances after leaving the sympathetic chain before finally synapsing and then a shorter distance to the effector organs. This one is wrong because parasympathetic fibers actually travel long distances after leaving the parasympathetic chain. Okay, finally synapse happens. The next statement is parasympathetic fibers travel a shorter distance to their respective ganglia, which are located close to the target organs. No, they are actually sympathetic fibers which travel a shorter distance to their respective ganglia, which are located close to the target organs. Okay, so this is not the answer. The next statement or the last statement is motor neurons are located in the ventral horn of the spinal cord from where the axons come out and divide into several branches and each of which supplies an individual muscle fibers. This one is actually true. Motor neurons are actually located in the ventral horn of spinal cord. Yes. And where the axons come out and divide into several branches and each of which supplies the individual muscle fiber. So the answer here is B. 1 and 4 are the true statements. What is the normal insensible water loss? So this is a factual question. Normal insensible water loss is actually 50 milliliter per hour. Okay, so the answer here is C. 50 milliliter per hour. The next question is a woman has vomiting whenever she eats spicy food. Arrange the sequence of events during vomiting. So First thing happens is reverse peristalsis in small intestine. Then it will lead to relaxation of the pyrolic sphincter. Then it will lead to stronger contractions in the stomach. Then the thing happens is inspiration against a closed glottis. Then lower esophageal sphincter is open and upper esophageal sphincter is closed. And then thing happens is lower esophageal sphincter opens and upper esophageal sphincter opens. Okay. So the answer here is 642315. The answer is B. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.